Hello bellspalsyers, so today I would like to talk to you about physical therapy and Bell's palsy, and something that anybody that suffers from Bell's palsy and is looking for a physical therapist, which to me I think is an essential part of the recovery of Bell's palsy, is learning, training with a physical therapist, a trained physical therapist. You'll see later on why this is important, but being trained with facial exercises and different techniques and adaptation to your specific needs. Everybody is different. I treat Bell's palsy every week, and I never see two people that have the exact same presentation. So things that can work for one will not work for another. So that's something to be aware of, and I think the more you realize this, the more you need to realize that it's important in order to progress correctly and not have any complication like possibly synkinesis. A lot of the exercises are available online, on groups. People give others advice. Some people say you should be chewing gum. You should never be chewing gum to retrain your muscles, because the reason is you're going to have so many muscles that are going to work together, and this is exactly what you don't want to retrain, because this could lead to synkinesis. So all this stuff is something that a trained professional, and I'm going to talk about a PT since I'm a PT and I know that, that they would know that, and they would know exactly how to help you with your Bell's palsy. So that said, I would also encourage you to be discriminatory in picking a physical therapy that can help you with Bell's palsy. Bell's palsy is not something that is taught in physical therapy school, and even though physical therapists these days, or physiotherapists, if you're anywhere in the world but the US, they are, at least in the US, they have a PhD, so they have a doctorate, and even though they have a doctorate, we don't get any training on Bell's palsy in school. So finding a therapist that is trained in Bell's palsy can be difficult, but it is well worthwhile in regards to seeing progress and improving with your Bell's palsy and facial paralysis. So I would be discriminatory, and I would call various clinic, and I would ask point blank if they have any experience in treating Bell's palsy. If you sense any hesitation, I would probably just avoid that, avoid working with them. And you can also ask them a question. I think if you ask them what synkinesis is, and ask them more about synkinesis, and if you feel like they don't really know what synkinesis is, I would stay clear from that therapist, because they might be pretty awesome at treating back pain, neck pain, and ankle sprain, and even cancer, and helping with cancer. Well, of course, PT doesn't cure cancer, but as well as strokes and people that are paralyzed, paraplegic, and all that stuff. This is great, but you need to find a PT that has a niche in Bell's palsy in order to help you, because it is something that for my part, I learned with continued education, reading materials, books, reading studies, and doing a lot of personal research on that, as well as over the years with experience. So please be picky in choosing a PT, but know that PT is actually a great thing and can really help you, as long as you are working with the right person. So all right, that's it for today. Have a great rest of the day. Bye-bye.